Hello and welcome back to my channel. As a dermatologist, I see the bread and butter of dermatology on a daily basis. Things like acne, rosacea, psoriasis, warts. Those are the types of things that we see day in, day out, and that's what most consumers are aware of. But here's 5 crazy skin conditions you might not be aware of, and I'm going to explain what's going on in each of them. Today I'm going to be covering 5 rare or unusual skin conditions. This is a reaction to another YouTube video that kind of consolidates these, but I'm going to go more in depth and talk about what's actually going on with these different types of syndromes and help you understand why they happen and hopefully educate you a little bit on them. Number 1 is hypertrichosis. This is also called Ombre syndrome, and excessive hair growth is a big feature of this. This is what it causes. It is a genetic mutation, and it's actually autosomal dominant. There's cases of this in history where we see, some of these paintings documenting that. So Ombre syndrome is an autosomal dominant mutation, and that means that if you have it, there's a 50% chance that your offspring could have it. These individuals get hair growth everywhere on their body except for the palms, the soles, and the mucous membranes. The reason for that is because we don't have any hair follicles in those areas. Like with any unique or rare genetic condition, individuals with Ombre syndrome are subject to a lot of ridicule and social isolation. And so it's important, I think, to understand what's going on in these cases. It doesn't in any way change who these people are, but they certainly have a burden that they carry with them throughout their life dealing with this excessive hair growth. In some circumstances, individuals with Ombre syndrome may have facial and dental abnormalities as well. Now, as I mentioned, this is autosomal dominant, and it's thought that the mutation that occurs in our DNA happens on our 8th chromosome. So that's what Ombre syndrome is. Let's move on to the next one. So ichthyosis comes from the Greek word meaning fish scale. These individuals can get really thick, dry, scaly skin. Can happen all over their body. This shows that there's a lot of different types of ichthyosis. Ichthyosis is just a general term, but it encompasses dozens of different types of dry skin conditions, some that you're born with and some that you acquire as you get into childhood or adulthood. Now, some of these ichthyoses that you're born with, they can be an autosomal dominant ichthyosis. That means that there's a 50% chance that your offspring will get it if you have it. There's also an X-linked type, meaning that usually it's carried by women, but it manifests more commonly in men. Some of these can be quite severe and very debilitating, where individuals with these ichthyoses, they're shedding skin all the time. They're just flaking, and it's really difficult to manage. They're often itchy. It significantly impacts their quality of life. The chronic inflammation in the skin contributes to an accelerated skin aging, and it's really psychologically devastating. Now, ichthyosis might just be an acquired condition as well. That means it develops later on in life, and it's not necessarily due to a genetic condition, but it can be acquired if you have other medical problems. Sometimes individuals with certain types of cancer, like lymphomas or leukemias, may be more predisposed to having dry and itchy skin. An underactive thyroid can also predispose you to having dry and cold, lusterless skin, where you're going to manifest some of these symptoms of ichthyosis. Sarcoidosis and HIV infection are other conditions that might give you an ichthyosis. As is shown in the video, the most severe form of ichthyosis is something called harlequin ichthyosis. This is present from the moment of birth, and in many cases, it's unfortunately a fatal condition. These babies are born with thick, armor-like plates of scale still attached to the body. Those thick, hard scales can actually make it difficult to breathe so that the baby can't expand and contract the chest, and that inability to breathe really well predisposes them to lung infections, and it's part of the reason that they have a premature death in many cases. Also, that compromised skin can increase the risk for infections that also lead to complications and in some cases lead to the death of the individual. Fortunately, harlequin ichthyosis is really rare, affecting only about 1 in every 300,000 births. It's also an autosomal recessive condition, which is part of the reason why it's so rare. That means in order to inherit it, you have to have the bad copy of this gene from both mom and dad in order to come out and be a harlequin baby. Now, in some circumstances, it may be a novel or new mutation in that individual, and mom or dad may not have been a carrier. The next condition is called argyria. This is the blue man or the Smurf man. This is caused by exposure to silver. Silver was thought to be, and still is in many cases, a healing remedy, but it's non-FDA approved. And when you take colloidal silver or other forms of silver, you can actually get your skin to turn blue in localized areas or over the entire body. Taking elemental or colloidal silver as a healing remedy is not recommended by doctors because of this risk. In pop culture, there have been a few people with argyria that have had some national prominence. One is Stan Jones. He was a Senate candidate from Montana. He often promoted colloidal silver as a home healing remedy. Again, not recommended. Another individual named Paul Carrison had this condition. Here's a photo of him with the condition, and before he developed the condition, he had his own homemade silver remedy, which he promoted for many different healing purposes. The next condition is called neurofibromatosis. Neurofibromatosis can be very severe or it can be very mild. There's a wide range of presentations available, but this is tumors that develop around the nerves. Neurofibromatosis comes in two different varieties. We call them NF1 and NF2, or neurofibromatosis type 1 and neurofibromatosis type 2. NF1 are the images that we saw here in this video, and these individuals may not show any signs at birth, but there's a number of different manifestations on the skin that may give clues early on before somebody starts to develop these bumps on the skin, which we call neurofibromas. They may have a number of light tan or brown spots called café au lait macules. Now, these are a really common type of birthmark, and if you have one, it's not anything that you should worry about. But if you have many of these spots, it may be one clue out of many that could indicate a risk for neurofibromatosis. Again, if you have one of these spots, it's nothing to worry about because they're really, really common. These individuals may also show freckles or lentigines. These are little light brown spots, much smaller than a café au lait macule, in the armpits. We call this axillary freckling or Crow's sign, named after Dr. Frank Crow, an Idaho dermatologist who first described that. Another sign may be little nodules around the iris of the eye called Lish nodules. That can be really characteristic of neurofibromatosis. And if you have two or more neurofibromas, that may be a tip as well. But there's really a constellation of symptoms that have to be present in order to make the diagnosis of neurofibromatosis. At its mild end, most people are unbothered by this. They may have a few of these neurofibromas develop on the skin, but in more severe forms, obviously, they can be covered in neurofibromas, and it's really difficult to treat. Usually in the clinic, we'll only remove the neurofibromas when they become painful because it's quite burdensome to try to remove dozens and dozens of these. These individuals have a really small risk that some of the neurofibromas could become cancerous. And so it is important to monitor them and to follow along with a dermatologist if you have this condition. So here's some images of really severe neurofibromatosis. These individuals they're just covered in them. And the final condition is Lewandowski-Lutz dysplasia. This is also called endodysplasia verruciformis or tree man syndrome. This is where individuals are infected with HPV or human papillomavirus. There are dozens and dozens of different strains of the HPV virus, and in these individuals, they're susceptible particularly to excess growth of the skin tissue when they're infected with HPV type 5 and 8. For most individuals, you're exposed to these viruses very regularly. You may carry them, but most people don't develop this condition. These individuals have an inability to fight off that virus and to prevent this. So this tree man syndrome, they get the HPV wart-like growths all over, particularly the hands and the feet. It looks like they're turning into Groot. Really debilitating because they lose the function of their hands and their feet. And these individuals are at high risk for developing cancer. We know that certain types of HPV, particularly 16 and 18, have a high risk for causing things like cervical cancer. Now, most HPV types are just going to cause a wart here or there on the body, but if the body is unable to fight them off, then they can increase your risk for skin cancer. It can turn into something called squamous cell carcinoma of the skin. For most individuals with endodysplasia verruciformis, the warts begin to develop in childhood. When it occurs later, that's what we call Lewandowski-Lutz. That's developing around the age of 20 or older. But regardless, this is a debilitating condition with significant social consequences and significant health consequences if somebody develops squamous cell carcinoma from it. As a dermatologist, we're trained to identify, diagnose, and treat these types of conditions, as well as all of the bread and butter stuff, that acne, rosacea, psoriasis, warts. So these are kind of some of the more unique conditions. It may be interesting to learn about, but the individuals that suffer with them have significant social and health consequences. I hope you've enjoyed learning about this topic, these 5 rare skin conditions. Let me know what else you'd like to learn about, and I'll see you next time.